ahead and get started. We're going to record this and we can send it out to the attendees who were not able to make it. So for today, Dr. Tracy is going to be doing the presentation for you. Dr. Tracy, with over 2 decades of experience in integrative healthcare, Tracy is a naturopathic doctor who treats IBS through a root cause, evidence-informed approach. Having lived with IBS herself, she brings both clinical expertise and deep personal insight to her work. Tracy co-founded the Tummy Clinic to offer personalized care that integrates diet, lifestyle, and mind-body medicine, with a strong focus on the gut-to-brain microbiome connection. She began her journey at Queen's University, earned her Doctor of Naturopathy from the Canadian College of Naturopathic Medicine, and has pursued advanced training in mind-body medicine through Harvard's Benson Henry Institute. Tracy was also the host of Town Hall Medicine, the Microbiome Summit, a project with the University of Toronto that translated research into real-world strategies for patients. Thank you, Tracy. Do you want to take it from here?
Yeah, thanks, Jen. So I'm just going to switch over to share my screen and I will start the presentation. Okay, can you see my screen okay, Jen?
Yep.
Okay. So right, this one ends. So who we are. So the Tummy Clinic is a virtual care clinic. It specializes in IBS and other related functional gastrointestinal disorders. Our program was designed by 2 gastroenterologists, Dr. Ian Bookman and Dr. Talia Zenley, both of them practicing in Ontario. The clinic was founded because we saw the need for collaborative, evidence-based care implemented by allied health experts. We're fully virtual. We're serving patients across Canada, and we are rooted in compassion, science, and sustainable results. Our founders, Dr. Jen, a naturopathic doctor, Dr. Ian Bookman, Dr. Rahima Hirji, another naturopathic doctor, Dr. Talia Zenley, the second of our gastroenterologists, and myself. Who we help? Well, we support individuals struggling with all types of IBS. We support patients that are suffering from functional diarrhea or constipation. We're dealing with abdominal pain and bloating. And we help those dealing with post-infectious IBS. And we also hear this a lot. Everything is normal, but I'm still suffering. So we really have a lot of compassion for those patients that are falling through the cracks in the current healthcare system. We specialize in complex cases. These are patients who, after years of frustration, come to us. So the majority of our patients are coming to us through referrals, through gastroenterologists and through family docs, where these patients are requiring an integrative approach. So our ideal patient, have seen multiple providers without resolution. They're ready, to tackle root cause oriented, sustainable results. They want more of a team-based approach, not just prescriptions. And they're open to exploring how diet, nervous system regulation, and lifestyle affects their symptoms. We really do get across to patients that this falls in, the disorders of gut-to-brain interaction. Okay. Our care model, we offer very much a team-based virtual approach. So we have our naturopaths who provide not just medical diagnosis, confirmation for our patients, but we spend a lot of time on patient education. We're using over-the-counter medications, including herbals. In Ontario and in Alberta, naturopathic doctors do not have prescribing rights for many of the, prescription meds that can help, especially with IBS-C. So we do have a nurse practitioner in Ontario who provides the medication support following medical algorithms. In Alberta, the pharmacist will hopefully be filling that role. Okay. So we have registered dietitians on staff. All have been Monash trained in low FODMAP diet, and they're very much focused on, gut-directed nutrition care. Okay. We do have gut-focused psychotherapists focused on nervous system regulation, brain gut therapies such as gut-directed hypnotherapy, as well as various, meditation, yoga, suggestions as well. Okay, we have our patient care coordinators who provide that seamless patient experience. We are very much evidence-based, compassionate, and coordinated in our care model. So how we care for patients, we do a comprehensive intake, even though they may have been referred by a gastroenterologist or a family doctor. We want to hear the patient's symptoms in their totality. And we're also very much focused on understanding the patient's goals. Patients will often come to us, wanting to have a cure, and we very much have to explain that this is a disorder of the gut to brain interaction, and we are looking towards, an interdisciplinary strategy with as much support as we can give them. So we're focused on, three kind of buckets. We've got the medical bucket where we're using either over-the-counters or medications, the nutrition bucket, and then the therapy support. All the while, we are collaborating and tracking. So we do use tracking apps that patients can plug in, their stool, they can plug in symptoms. The one app we use primarily is the one through the Canadian Digestive Health Foundation. And our goal is very much to empower patients with long-term tools. So what makes us different? Well, we don't chase fads. So patients will often come to us, saying, I've heard about SIBO tests or microbiome kits, and I'd like to try that. And we very much have to, go through patient education, to explain why they probably do not have SIBO and that their symptoms are very much IBS related. And that microbiome, research at this stage is still in its infancy, and there isn't a lot that we would be able to use with that information in terms of this clinical value. Okay, we focus a lot on the nervous system, gut axis, and we're bringing medicine, diet, and psychology together. And we are the only clinic that we know of in Canada that is doing this. We're supporting real healing, not just symptom band-aids, and we educate and empower our patients. And this is one of our top priorities, is for patients to really understand what they have and to feel like they have a toolkit after they spent some time with us. Okay, our goals for patient success, we strive for greater than 75% improvement in symptoms within 4 to 6 weeks. We feel this is a very reasonable goal when we're able to understand the patient's symptoms and we're able to understand their goals as well. Okay, we're known for reducing ER visits and medication reliance over time, which is why a lot of gastroenterologists and family doctors feel confident in referring to us. In Ontario, we have over 140 MDs who are referring into our clinic. Okay, we're prioritizing food of freedom, IBS education, mental well-being, and long-term success. Most of our patients achieve meaningful relief within the first month. Okay, our mission to transform IBS care from dismissive to empowering and effective. We do that through collaboration with our patients and other healthcare providers. We really work towards patient empowerment, evidence-based practice. We use a whole lot of empathy, and we are motivated for long-term healing. Okay, you can reach us on our website, through our email, and through our social. Okay. I'll stop screen sharing at this point.
That's great, Tracy. Thank you for
Yeah.
going through the logistics of the clinic. Are there any questions for Tracy? Oh. Neiman?
Hi, Munima. Yeah,
Hi. Nice to see
thank you very much for the presentation. That was great. Um, I guess for like referrals and things like that, do you have pamphlets and materials that you give to clinics or societies or pharmacies that can direct people towards the tummy clinic?
Yeah, that's a very good question. So we do have a referral form. It's on our website, and we're happy to send it, to anyone who requests it. And it's just, your standard fillable form. It can go into electronic medical records as well. Yeah.
But we do also have standard brochures and things that we could send out to the pharmacies that are interested if they wanted to share those with their clients. So Dr. Talia Zenley, she will be putting together a presentation, or she has put together a presentation, and it's going to be scheduled in July. So we'll send out the invites for that. It's geared towards family doctors and information about prescribing for IBS and the medications involved and the nuances with that. More of a casual discussion that she wants to have. You are welcome to join that, and we'll send the invites out for those as well. Any other questions? Great. So we will end it here. We'll send out the recording. If anyone on your team has other questions about nuances of how to refer to us and vice versa, happy to chat with them and discuss those pathways. But thank you so much for your time and attending today. We just wanted to give you a brief introduction to who we are and get that started, and just be mindful of your busy work days as well.
Thank you very much.
Yeah, thank you.
Bye.